the introduction and everything. So hi, everyone. My name is Kristin Eastep, and I am a wellness coordinator for Healthy UNCG, which is UNCG's Employee Wellness Initiative. This is our last session for our fall virtual wellness series. If you've been to our other videos and our other presentations, thank you so much for joining us and for going on this journey with us. And if you've missed sessions, they are up on our YouTube channel and on our website for you to go back and watch, or feel free to email us. We can send those out to you as well. Today, we have a great presentation on navigating the ups and downs of caregiving for older adults with Dr. Elise Eifert and Kathryn Roosevelt. So Dr. Eifert is currently the coordinator for the online graduate program in gerontology at the University of North Carolina at Greensboro. She graduated from UNCG in 2014 with a PhD in public health education. And her research agenda focuses on how individuals transition from their former role in the family caregiver role and how that transition affects identity and the use of home and community-based services. She's a certified health education specialist. And then we also have a PhD student with us, Kathryn Roosevelt, who's received her master's of social work and is currently getting her PhD at UNCG. And then Kathryn did this after 10 years in the field post her social work degree, working in a variety of settings, but always with the focus on aging. So we are so excited to have them here with us today, and I'll let them introduce themselves a little bit. But again, if you have any questions about what's going on, please drop that in the chat. We're here to monitor the chat as well, and we are so excited to have you.
Thank you for that introduction, Kristin. You captured and described us pretty well, but I will just add to that Katie and I have known each other for close to 15 years. And we actually began our careers together in Southwest Florida for a nonprofit Alzheimer's organization housed out of Fort Myers, Florida. And in that location, I was the health educator and Katie was the social worker. By the way, I'm Elise. This is Katie. We were a team there, and we were primarily serving caregivers, family caregivers of people with different types of dementia. I did a little work with professional caregivers in long-term care settings as well. But we both really, fell in love with the caregiver population at that time. And I've continued that with my research. And then Katie's kind of worked with family caregivers off and on over the past 15 years. But it's really where our heart's at career-wise. We really value and appreciate the family caregivers in the world. So I wanted to give that a little background before we begin. I'm going to share my screen because I have a presentation here. All right, can everybody see that?
Yeah, you're all good.
Perfect. And how's our sound?
Perfect.
Okay, thank you so much. So we're going to talk obviously about family caregiving today. There's a lot of different perspectives on caregiving. So we're going to define and describe what we see family caregiving as in the United States. And we're definitely going to talk about the different aspects of caregiving and how it's a little bit of a roller coaster ride with ups and downs. And then we're really going to zero in on help and assistance. And that includes some local places as well as some national places. And then we'll open it up to questions, and we're happy to have a good discussion with anybody who's joining us today. And if we can help you navigate family caregiving, we certainly want to do that for you. So I like to begin any conversation about caregiving with this beautiful quote, and it's used very frequently, but it's from Rosalind Carter. And if you don't know, that's Jimmy Carter's wife. And both of them have been huge proponents of family caregivers for decades. There's actually the Carter Institute out of Georgia that focuses on family caregivers, mostly with family caregivers of veterans, but they do a lot of research and support family caregivers. But I love this quote because it really speaks to who caregivers are and how common caregiving is. And so Rosalind Carter said, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So it just tells you that no matter who you are, caregiving is going to impact your life one way or another.
So if you look, there's a significant prevalence, and I think Rosalind Carter kind of tags that this is extremely prevalent. You'll experience it to some degree in your life. But caregiving itself is anyone at all who provides unpaid, it's that word right there, assistance to an older person who to some degree, and that's varying in degrees, in the need for help or aid. In 2020, you can see that we had 53 million family caregivers. Okay, so I think that that's really an important idea and an important understanding. And it identifies, there's a lot of us. There's a lot of us doing something in this world with regards to caregiving. And then we're seeing an increase, expected to increase to 85%. And when you look at that from 2050, 2000 to 2050, and 85%. And when we think about that, we can identify reasoning, which is we're getting older. Our population is getting older. We're going to see those baby boomers continue to advance in age. And so the understanding and the necessity is its family caregivers will be even more prevalent.
Family caregiving can impact anybody, but there's definitely a kind of common profile that we see with family caregiving. One is that they're predominantly female, and this has been throughout the history of caregiving. And this has changed a little bit where more males are kind of stepping into the role, but this is traditionally caregiving has been a very female role. A lot of times it's adult children. There's also spousal caregivers and of course other types of relationships as well, but adult children caring for a mother is the most common. Most of these people are middle-aged, average is 49. Most are married with children, and most are employed full-time, around 61%. So when you think about this profile and you look at this profile, and I'm also looking at the faces that have joined us in this conversation, I'm seeing a little bit of this female, probably adult child, probably middle-aged. But what we see here is a person who's getting pulled in a lot of different directions, right? So we have all these different roles in our life. And if you're, married, if you have children and you're working, and then on top of that, you have responsibilities to care for an aging family member, that's just a lot. So I like to paint this picture of who is typically the family caregiver. And it's not to say that there aren't, other types and other profiles of caregivers. There's a lot of diversity and a lot of cultural impact to caregiving. I always bring up the point that in a lot of Asian cultures, males, especially the oldest sons, they're the ones that are often expected to step into the caregiver role and care for aging parents. And so that's very different. I see regional differences in the South, a lot of generational families, that's still very important, and a lot of differences between metropolitan and rural areas. So this is just averages. It doesn't mean it's the only type of family caregiver, but it's important to kind of point it out.
So obviously, as a caregiver, when you think about the different help, the different aid that these individuals are needing, there's going to be a lot of responsibilities. So pretty much caregiver responsibilities encompass a wide range of activity, services, and support, assistance with activities of daily living. So those ADLs that we hear talked about all the time, which are things like bathing, dressing, eating, the things that are necessary to provide help, to provide that assistance every day. There's also instrumental activities of daily living, money management, grocery shopping, transportation. Again, things that are absolutely necessary to someone having that quality of life every day. Obviously, when we're thinking about responsibilities, the importance of having strong advocates, individuals who are there to support you, people around you to provide emotional support as a person who's providing caregiving, having some type of management of services, things like liaisons, stuff like that. So you want to think about caregivers needing to be sort of wrapped around service-wise. Caregivers perform tons and tons of responsibilities. When you think about all the help and assistance that individuals need, depending on what they're going through, you're going to have caregivers, who aren't necessarily trained, assisting with nursing tasks. So oftentimes it might be medication management. It could be things like providing assistance with even, infusions, stuff like that. So there's going to be a lot of those types of services that caregivers need to provide, again, without training. And you have to think about that, as you're stepping into that role, the type of services that you're going to be providing to your loved one, because it's challenging and the responsibilities feel endless. But again, if you have those wraparound services, it doesn't feel so lonely. So
I just want to point out too that for a lot of people, when they think about these caregiver responsibilities, they see it very much as an extension of their former roles. So they don't always immediately identify as a caregiver, and they don't think of the things that they're doing as caregiving responsibilities. We've both heard people say, well, I'm not a caregiver, I'm just helping my mom out. Or, I'm not a caregiver, when I got married, I said for better or for worse, and we're going through a worse time right now. And so it's important to really recognize all the little things that caregivers do, whether they identify as a caregiver as not, whether it's something as simple as advocating for their partner or advocating for their mom or scheduling doctor's appointments. That's part of the caregiver role, and that should definitely be recognized. So there is a lot of time spent caregiving. Again, these are all just general averages, and it really depends on the care recipient and kind of how much assistance that they may need. The average caregiver spends around 24 hours per week providing care, and they do that on average for about 4.6 years. So again, when you start thinking about roles and responsibilities, and you're thinking, okay, I have a full-time job working 40 hours a week. I come home and I have to cook dinner for my family. And then on top of that, I also have to make sure mom or dad is bathed and changed and well cared for. It's a lot. And then when you think about doing it continuously for close to 4 or 5 years, you start to see how this can be a lot of work, and it can become really challenging. And then I also want to, just point out that a lot of times this 24 hours or 24 per week and 4.6 hours, it's continuous without a lot of break and reprieve. I think, traditionally we often think about dementia caregiving, and that adds extra layers to caregiving. So we often see people who are providing care to loved ones with dementia spending more average hours per week and for a longer period of time as well, and with the least amount of breaks.
So as a caregiver, again, I think I piggyback on what Elise just said, is oftentimes these individuals don't identify as a caregiver. They see that this is what I do. I provide this service for mom, I provide this service for my spouse, this is what I do. And because of that, there's definitely ups and downs. You're going to have both positive and negative emotions tied into that because of the role. There is something to be said about, knowing that you're the one helping your loved one. There is something positive in that association. It's going to, do things like, make you feel satisfied, make you feel like, that purpose is really strong for you. But the other side of that is when you think about the roles that these individuals are taking on, when you think about the challenges associated with not having a break, with not having rest, there's also going to be a lot of associated emotions with that. And I think when you think of someone with dementia and you're caring for them, if you see that top negative emotion of worry, 51% are experiencing some level of worry. Oftentimes, dementia could involve things like wandering. It could involve things like high fall risk, medication mismanagement. So there's a lot of worry associated with that. But again, if you see the percentages of positive emotions to negative emotions, you'll notice that the positive emotions are pretty strong. And so I think that that is something that as a caregiver or as someone talking with a caregiver, that you do allow them to see that, you can be honored and you can be proud to do this, but also to understand that there are challenges associated. And it's finding that balance. It's really finding that balance between the two. But again, knowing that this population of individuals caring for loved ones often have and continue to have varying roles, from being mom to being caregiver to being employee, whatever that looks like.
The emphasis on the negative related to family caregiving is it's unfortunate, but it gets a lot more attention than the positives, even though positive aspects of caregiving is very well researched and it's out there, and most caregivers are able to tell you that there are good things that are happening from caregiving. And so we really want to highlight that, because we want caregivers to recognize that, whether you're new in the position, whether you're not even there in the position, maybe caregiving is on the horizon for you, or whether you're 10 years into a caregiving experience, to really recognize that there are positive aspects of family caregiving and give yourself credit for some of that positiveness. And then just to kind of reiterate the fact that positive and negative, they're not exclusive to each other. So, you can have days that are, mom took a bath and she changed her clothes and she smiled and laughed. And that's a day that you can pat yourself on the back and you're like, yes, today was a good day. And then the next day, maybe there was some wandering and some frustration and acting out. And that was a tough day. And that's okay. And caregiving is literally a roller coaster. There are ups and there are downs. And so we have to celebrate those ups and be, live in that moment when there are good times, and then try to address when there are difficult times and more challenging times. And all this data, by the way, I do want to recognize is from AARP. It's not my own research by any means. AARP does, a lot of really great stuff with family caregivers. Oh, my PowerPoint froze up. Let me stop sharing and I'll try to do this again here. Sorry about that. So these are just some really great quotes, again, emphasizing that positive, joy-filled experience that caregiving can be. And so some of the positive feedbacks that we often hear from caregivers is, getting to know more about my mom's life before I was born, or he is a role model and a friend to my 3 children. They love visiting with him. Giving back is a joy. My father fought in the 442nd Battalion and earned a Purple Heart. He deserves all the care in the world. Or I'm learning how to be patient and how to appreciate the value of a relationship, right? So, caregiving is definitely a learning experience. And I think a lot of people will say that they learned a lot about themselves as well as their loved one through that experience.
So I'm just going to really quick kind of reemphasize what we just talked about, which is I think acknowledging the positive parts of caregiving, because these next few slides talk about stress. And I think so often that's highlighted that sometimes the word caregiver just can ensue fear in people. And again, you're going to have stress. You're going to have stressors that arise, but if you recognize the positivity and you can associate with the positivity, it could help decrease the caregiver stress. Again, you're going to have it, but it can help by just identifying those positives. But with that said, we do have to talk about caregiver stress because it will come up, it will happen. And so there's emotional and there's physical strain with caregiving across the board. Obviously, depending on the type of help, the type of aid you're providing, that emotional, that physical will differ. But some of those factors that contribute to that strain are things like conflicting demands. Again, if you think about roles, those are conflicting, right? You're going to be pulled, as Elise had said earlier, in multiple directions. And then at times, depending on the person that you're assisting and caring for, those demands can also conflict as well. When you're making dinner, but then something happens medically or cognitively or emotionally with your loved one, and so you're pulled in another direction. And so you feel a lot of that kind of almost dizzying at times, being pulled in so many directions. Feeling a lack of control. We all want to believe that we have it. It's often an illusion, but we definitely feel a lack of control with caregiving because no 2 days are the same. Sometimes no 2 hours are the same. And uncertainty that comes with medical conditions, uncertainty that comes with your loved one, again, having a good day and then not having such a good day. And so you feel that. And when you feel that lack of control, that can induce so much emotional anxiety. See a lot of anxiety with individuals who are caregiving, again, because you live kind of in this hypervigilant state at times. Again, so acknowledging, I think, just that lack of control at times is part of it. Sometimes it's just recognizing the lack of control. Lack of privacy. We all like our privacy. We like our alone time. And as a caregiver, that diminishes. Now, are there times that we have it? Absolutely. But it will not look like we think it should. We're going to live in that should world sometimes. And it's important to acknowledge that our shoulds don't always look like we need it to, and the privacy will diminish. You might have intrusion. For instance, if you have someone with dementia, that knowledge base there could be intrusiveness at times. Again, unintentional, but intrusive nonetheless. Or again, if you're having to monitor something medically in your loved one, that's going to hinder your ability to have that privacy. And that can, if you're married or if you have children, that can really cause some additional emotional strain. And that kind of piggybacks to little time for you, little time to be with yourself. That self-care that we know and love and we need, it can really diminish. Again, it's finding that balance at times, but it diminishes. It is a fact. Role confusion. I talked about dizzying earlier, and you think about, okay, so I'm mom, but I'm daughter, but I'm spouse. And sometimes you can get so wrapped up in trying to manage all of that you may find that you treat your spouse more like your child because you're needing things done, or perhaps you're asking more of your children than they're capable of because you're needing that extra help. And so there can be a lot of role confusions with that. the unreasonable demands, the expectations that we put on ourselves, but I think also what others might put on us, in the belief that, well, you have this role, you do this role, so you have to take on all the responsibilities of this role. And it is at times unreasonable, some of the things we ask of ourselves and others ask of us. And I think it's just important that we acknowledge that and verbalize and recognize what we can and can't do. And that goes into the unrealistic expectations. We have them, everybody has unrealistic expectations to an extent, but then you take on this new role as a caregiver, believing, again, to a very hopeful space that you're going to be able to do all of these tasks, all of these responsibilities, because you want to, right? You want to make sure that your loved one is cared for, but it's important that you recognize the unrealisticness at times.
It's actually okay if you don't want to be a caregiver as well and you're resistant to it. That's also absolutely normal. So I just want to acknowledge that.
Absolutely.
I want to just comment about the unrealistic expectations, though. There's no such thing as a perfect caregiver. This is a lot of times a new role for the majority of people who step into it, whether that's by choice or by volunteering. And so, or out of necessity, I guess, choice or necessity. But the gerontologist, which is one of the leading gerontology journals, a couple of years ago came out with a special issue of articles that were all gerontologists, and they were all reflecting on their personal roles as caregivers. And even those people who had been in aging for decades still had struggles and still had issues. And so that's what I want to point out with the unrealistic expectations. I think a lot of people go into caregiving gung-ho and they're like, I'm excited to do this. This is a great opportunity to spend time with my loved ones. And I'm happy, I'm honored to do that. And then realize that it's a little bit harder than maybe they would have originally thought. So it's important to have those realistic expectations.
Dr. Eifert and Kathryn, we have a couple of comments and a couple of questions that have popped in the chat from these slides. I mean, I don't know if you can see the chat, but one question was, what recommendations do you have for people to hone in and hold on to those positive emotions that may be hard to pinpoint?
So, I think with anything, with anything difficult in our lives, it's important to have hope, to hone in on hope, to set or recognize that intention every day. Again, because sometimes it's so overwhelming that we do forget about the positive. I think that goes in life in general. We're a society that pays attention to the negative. And so I do believe setting that intention and recognizing every day, when you see your loved one, remembering the great times, recognizing the good times, and staying hopeful for the future. Again, because the hard will sometimes feel like you're drowning at times and you feel like you can't pull out. And so I think it's just really important. It's a type of cognitive restructuring, if you will, where you reframe what's right in front of you in order to just change your script for yourself, to recognize, okay, today is hard, tomorrow will be better, right? Kind of, just faking the belief, even if it doesn't come to fruition, because the truth is if you do step back and you remember the good, it's that balance that I talked about earlier of the positive and the negative. And it's finding that balance and it's forcing that balance. Again, because it can be so overwhelming. And sometimes, when you have things like dementia, you have this continuous progressive decline, again, and that can be slow or fast. And that can be daunting, to think, it just keeps getting worse. How do I have hope? But the truth is it's in those good moments and it's in those memories that you hold on to, because that's how you can continue to do what you're doing. And again, if we stay honed in on the negative, on those really challenging times, undoubtedly, it will make it that much harder to continue that role. So
Caregiving is definitely a journey, and it can, if you're continually looking at the future, it can be really hard to see the light at the end of the tunnel. So one of the things I would definitely recommend is trying to be present and in the moment as much as possible. So when there are good times and there are joys and there are something that goes well for you in that caregiving experience, to really just let that set in and remember that this is happening and this is good, and really celebrate that moment, because it may be followed by a couple of negative things or stressful things, but at that time, at that point, it's good. So we need to stop thinking so much about the future and how things may be tomorrow, and just really live right there in that moment.
absolutely.
And
Absolutely.
there's a great comment about maybe doing that with a purposeful gratitude journal.
Mm-hmm. Yeah, man, you guys are already like covering a couple of things that I'm going to mention here in the future. You guys nailed it.
Yeah.
See, our caregivers, they know what's up.
Yeah.
They've been there.
Absolutely.
Is there any other questions, Kristin? Okay. So all of this stress can have a little bit of a cumulative effect, and that's often labeled caregiver burden, which is such an ugly word. And we're really trying to get away from burden in kind of the caregiving community. And so it started to be called compassion fatigue. And that's also actually got pulled from the professional caregiving role, where a lot of professional caregivers just got tired of caring so much. And it actually happens with family caregivers as well. So you'll see burden a lot of times in the literature, but I'm going to substitute it for fatigue, compassion fatigue, because I think it's a gentler term, and I think more representative of what caregivers actually feel than burden. Very, very common among family caregivers. Around 68% will tell you that their stress is pretty high and it's impacting them in one degree or another. And the reason why this fatigue has to be recognized is because it's been correlated with a lot of negative health outcomes. So one is, and this is related to caregiver health outcomes. So one is poor physical and mental health. So we'll see a lot of caregivers who get colds a lot, or they report feeling depressed or a little low. We may see them be tired a lot. It's also related to something called burnout, which is reaching the end of your rope. So when that compassion fatigue gets so high, it legitimately, you'll have caregivers say, I just can't do it another single day. And that can be very problematic for not only the caregiver, but also the care recipient. So, it's important that we try to prevent burnout as much as possible. Another negative health outcome that is often recognized with fatigue is the participation in harmful behaviors, meaning that, maybe somebody who hasn't smoked in 30 or 40 years starts smoking again, or to help relax, they start drinking a glass of wine every night. But it can also mean things like skipping your doctor's appointments, not having your annual mammogram, and neglecting their own health. Sadly, it also can be related to elder abuse, and this is not an excuse, and I definitely don't want to say that compassion fatigue is an excuse for elder abuse, but you will often hear people who have been perpetrators of elder abuse saying that they were very highly stressed, and that's what led to the abuse. And then finally, a really alarming study came out about 20 years, and there's been some conflict back and forth with it since then. But there was a very respected researcher who found some data, or collected some data that showed that caregivers who were highly fatigued and stressed had higher mortality rates. And so that's very alarming to think that family caregivers are really, laying down their own lives to carry out the caregiving responsibilities. So that's something we also, of course, want to pay attention to.
So signs of compassion fatigue, and And these are a handful. Compassion fatigue is going to be individualized as well as generalized. So I think it's just important to recognize that we all experience fatigue differently. But health issues, which can be that contributing factor to increasing mortality rate. I mean, if you're not taking care of yourself, that can lead down to a very detrimental road. Difficulty sleeping. It's not uncommon to talk with a caregiver and they talk about their sleep disturbance, difficulty falling asleep, staying asleep, kind of living almost in naps where they're waking up every few hours because they're anxious or they're hypervigilant, they're listening for something, is mom getting out of bed, is dad okay? Is my spouse, is my spouse breathing? Yeah. So you think about that, you're not going to be hitting that deep sleep that's necessary. And that's going to cause feeling fatigued and tired, but it's also just caregiving can produce fatigue, tiredness,
emotional heaviness.
Yeah.
That's what I would call it.
Yes, emotional heaviness, absolutely. Yeah. Change in appetite, not uncommon for those who are caring for someone to change their appetite, whether that's to eat more or eat less, and often not eating properly. Again, so focused on their loved one that they may not be paying attention to what they need. Again, we get into that fatigue of over caring, again, with hopeful intentions, but it can really be detrimental to appetite. Trouble concentrating, that's going to be something that happens with caregivers to a degree. It's just the degree of how far they've taken it, how far that fatigue has taken them, and the difficulty to concentrate and pay attention, have that attention span can really be difficult, especially when you're juggling multiple tasks, and that's something that can happen and I've seen happen with caregivers where they're so overwhelmed, they're so fatigued that they have challenges managing their loved ones' medications. And sometimes they have medication errors because of that. Loss of interest in hobbies or activities. This often will fall into someone who's getting into that space of depression, feeling that emotional heaviness to the extent that the idea of doing something that they enjoy is no longer a joy, it's a task. They just don't have that interest anymore. And they feel that disconnect, and that's going to go hand in hand with loss of interest in activities. But also, if you look to the other side, that social withdrawal, you're just not feeling connected anymore. You feel like you live in your role instead of living in your life. And it can be really, really a difficult feeling. The decrease in work productivity, if you're feeling emotionally heavy, if you're not sleeping well, if you're difficulty concentrating, you can see how that's going to decrease that interest in work because you're going to be exhausted, but it's also going to decrease productivity because you're going to feel so overwhelmed. Oftentimes, we'd love to say that we leave home at the door, but we don't, we take home with us everywhere. And so if you're at work, you're going to still be thinking about your loved one or the tasks that need to be done. You start running your list, and that can really challenge that work productivity. Again, I think this has to be said, is that feeling of loss of control. Oftentimes, as I mentioned before, caregivers live in a hypervigilant state. And if that gets beyond a point of managing, we'll call it management, you can see a substantial increase in fatigue to the extent of burnout. They do socially withdrawal, caregivers socially withdraw often, especially when they're hitting that fatigue place, because they see it as a task. Spending time with friends, family, loved ones is a task. Yep. They cry easily. They're more irritable. They have agitation at times. This next one, the lower threshold for sympathy or empathy, we go back to where elder abuse could potentially happen, again, because you don't feel the ability to be sympathetic. You don't feel the ability to be empathetic to your loved one's cause. And you start blaming yourself, right? You get that guilt, that worthlessness that goes along with it. And then at times, suicidal ideation, thoughts of death, not wanting to be present anymore because you don't see a way out. Again, lots of things can happen with compassion fatigue.
With all that said, what we really want to advocate is for help seeking. And my research in particularly really focuses on caregivers' use of community-based services. And what we know and what this slide really shows is that unfortunately, family caregivers rarely seek help. It's about split 50-50. And we really want to see caregivers find the help and support that they really, really need, and have that help be recognized and easily accessible.
And you need to take care of yourself. As a caregiver, it's understandable to have compassion fatigue, but you can also prevent it by doing the one thing that's most important, which is taking care of yourself, making yourself a priority. And it's not selfish. There's nothing selfish about saying, I'm allowed to be okay, because if I'm okay, I'm better at taking care of my loved one. It's a really important acknowledgement to have as a caregiver, because what if something happens to you? What if, who's going to take care of that person? Really important to recognize that.
So we're going to move into a little bit of how you can get help. And these are both individual factors and also kind of outside of the home things that you can do. So the first one is really organization. It's really easy to be overwhelmed by caregiving, and so if you don't have a lot of organization, I think it just kind of layers and adds up and kind of snowballs, right? So one of the things that I would recommend for a lot of caregivers is to just get organized. And one way to get organized is really about your caregiving responsibilities. And we typically had recommended in the organization that we worked for is that caregivers get a binder, and they keep everything related to their caregiving in that binder. And so that way, if they had to go to a doctor's appointment, or if 911 got called and you had to jump into an ambulance, you could just grab that binder and it would go with you to the doctor, to the hospital, to anywhere that was important, and you had that information. And so that is often a relief to people. And then also keeping a calendar, just whether it's a paper calendar, whether it's on your phone, just being able to pull things up and know when medications are supposed to be delivered, when doctor's appointments are scheduled, when somebody is supposed to come over. That helps with almost that feeling of control. So when you're organized, you have a little bit more, you feel better about what's coming up. And then the last way, another recommendation to stay organized, taking notes at doctor's visits, and you can add this to your binder. I think we've all been there before, where we've gone to a doctor's and they just talk and talk and talk and talk, and you're in a state of stress, or you're in a state of being overwhelmed, and they just keep talking, and you're supposed to remember all these details, and it can just get really, really frustrating and very, very stressful. So when we take notes for important meetings, that helps us be able to go back to it and say, what did the doctor say? Or what did this social worker tell me that I needed to do? I'll add this to my binder, and I'll have all of this information in one place, easily accessible. And so there are all kinds of other organizational techniques and hacks. We'll get to a couple of caregiver organizations that can kind of help guide with that. But this is one really simple thing that I think caregivers can do and make priority.
Yeah, quick question related to that. Do you know, and you might go into this in your upcoming slides, but do you know if there's a suggested binder format with headings and tabs?
I think
if not, you should sell one on Etsy.
That's a good one.
I do, if I am recalling the multiple websites that I've looked at and the organizations I've been involved with, I will say that most of them have they'll have those they're like information packets that you can fill in. And so I usually will say, okay, so this is a starting point. Now make it work for you. Take that and work from it. I do believe the organization we worked for, I had sort of put something together with individuals who were caregivers and their loved ones in the early stages. Like, okay, these are the things you want to do. But there's not like a canned, and that may be a really good idea. There's not really a canned binder out there that I have found. Now, if someone finds it, send it our way.
I think the Parkinson's Association used to have one, but I haven't seen it in quite a while, so I don't know if it's been updated or not, but I can definitely do a little research and get back to you, Kristin and Stephanie, and maybe you can share it for people who signed up if you have.
Yeah, any resources you have,
yeah,
we'll send it out along with a recording of this slideshow, so it's available.
Gotcha.
So physical health for caregivers. All right, it's not about tasks, it's about priority. See your primary care physician, get enough sleep, eat healthy, drink water, exercise, stretch.
These are things we all need to do, whether we're caregivers or not. Right?
Yes. Do the things that bring you joy. You know, I think that I can't emphasize that enough, that caregivers continue to stay involved, to stay enmeshed in their life, and do things to relax, to help prevent, you know, relaxation, massage, meditation, whatever that looks like can really be a preventative measure because you stay present with yourself. And then diving into the use of respite. The idea of respite is getting someone to help and you taking time just for you.
Take a time out. It's okay.
Yeah.
And I just want to point out to you that joy and that relaxation, you don't always have to be like, I need to take a whole day off. Like sometimes it's just a minute to step outside of your front door and to take a deep breath and, you know, just try to calm yourself for, you know, the day ahead. It doesn't have to be significant to take care of your health. This, the next one is about spending quality time together. So somebody mentioned this about, you know, kind of living in the moment, but also remembering that relationship that you had with that person prior to the caregiver and care recipient role. So this is typically in family caregiving, this is a person who is important to you and you have a life history together, whether that relationship was spousal, whether it was a parent-child, whether it was a friend, you know, it doesn't really matter. But I think it's important to still prioritize that relationship. So, you know, even if that person doesn't remember you, doesn't know who they are, who you are, even if, you know, you just changed their soiled clothes an hour before, fight for that relationship, fight for that primary relationship. And it can be things that are really simple, whether it's holding their hand, talking about a shared experience together, hugging them, looking at pictures together of your life or the times that you shared, or just finding opportunities to laugh together. So it's taking the emphasis or de-emphasizing the caregiving and putting it back onto the primary relationship and reminding yourself why you're doing this in the first place.
You know, the organization that Elise and I worked with, we would have a social, and the loved ones would bring their spouses or their mom or their father, whomever it was. And this was such a great opportunity to remember that relationship. You know, the music would play and they would dance, and you would see the caregiver, but also the care recipient recognize that love, that appreciation, that affection, that relationship again. And so I think finding ways to remember is really important. So emotional support comes in a variety of forms. Support groups are always a really good outlet for caregivers because you're around people who get it. You know, there's nothing like being in a room and someone saying, oh my gosh, this is what I'm going through. And for another person to say, you know, I've been there. This is what helped me. You know, it's really, really beneficial, and it helps them feel not alone. Sometimes it's also very important to talk with a counselor, you know, to get that individualized counseling, especially if you're feeling some of that compassion fatigue, so that you can find ways to cope. for yourself. So that deep breath gets, reinforced, or restructuring the way that you're thinking about things gets enforced. Connecting with your spiritual faith, often faith-based organizations have outlets, and again, you're surrounded, you've wrapped yourself with people who are there to support you. There is a lot of online support. I mean, you can literally Google caregiving and a mass amount of support services.
Especially with COVID, I think I've seen an increase in it.
Yeah, there are Facebook sites, you really could probably talk about online support for a week. And so tap into that, utilize it, because it's often free. At times it does cost money, but it's often free and there are services available. Connect with another caregiver. I, again, thinking about my time at the Alzheimer's Resource Center, oftentimes it was like my caregivers had buddies, they had someone who was walking that journey with them very, very much almost simultaneously. And they connected with one another, just to be a person that they could call, that it was a person they could go to coffee with. And it was, again, a friendship, but also a service. Very, 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 very satisfying for the people. Keeping a journal, whether it's a gratitude and gratefulness, or it's just letting go of the day, whatever your journal looks like, sometimes we need to verbally vomit, we need to do that and
release it out in the world.
And sometimes it's, I have to find the things that I'm grateful for because I'm feeling overwhelmed, so you make your journal work for you. It's oftentimes people ask me when I say start a journal, they're like, well, what should it look like? What's the format? I'm like, make it work for you, whatever that needs to be for you. And caregiving is a very individualized journey. And sometimes it's necessary to write something down just to let it go, or to, go back to it later when you need some gratefulness or gratitude or remembrance that you need to put out there for yourself.
And here's our positive appraisals, which we touched on a little bit, about looking at some of the good that's coming out of caregiving and reminding yourself that you're a pretty incredible person for doing what you're doing and, fighting for your loved one and their health and their well-being. And so, reminding yourself that you're giving back, reminding yourself of satisfaction that your loved one is well cared for. Think about all the different ways that you're growing individually and the meaning that caregiving might be giving to your life, or the purpose. And I know a lot of people too like to think about how they're being a role model for their children, because one day, you're going to be the older person and who's going to be taking care of you. And when you're passing on that tradition to your children, that's something positive and to be celebrated as well. And then just reiterating again that, focusing on the positive, they're going to be there, but they're also going to be negative. They're not exclusive to each other. So sometimes when a negative experience happens, to, flip it around and try to remember, all right, what good is coming out of this? Like, how can I look at this as in a more positive way?
So you can activate your people. I think that speaks for itself, and we should all be activating our people, especially for caregiving. Build a support system, and it's whatever that support system is going to look like for you, whether that's friends, family, neighbors, church members, organizations, finding that support system, building on it and utilizing it, never being afraid to ask for help. It's a necessity. Sometimes, it's people bring you meals, sometimes that's what's needed. And they provide companionship, personal care, they do things like rake the leaves, or they come and, maybe they're hanging out with you and they help clean the house, whatever that looks like. It's people who will be activated for you, who are there for you. They're there because they want to be there for you. It's not that word burden. It's a blessing. They're there and they want to be. And don't be afraid to ask and accept. It's really hard for a lot of people, most people, to say, I need help. Especially when you're you're working or you're caring for a loved one. You know, I should, right? They use that word. I should be able to do this. This is my job. Well, the truth is we should not be able to do everything. And we absolutely must accept the help that's given. And sometimes you can do things like make a list and, you know, distribute the list to that support. And
or when somebody says, how can I help you? You've got a list right there to say, here, these are all the things that I could, you know, use your help on. Pick one.
Yeah, sometimes people will grocery shop for you, and what a relief that is. There's a book that's Share the Care, and it's a way of organizing how your support system can best help you. So this is actually kind of a step-by-step in a way to do that.
It's really good.
But I can't emphasize the importance of asking and accepting help. I think when I work with caregivers, it's probably one of the very first things that I say is, this is not a place to be afraid. This is a place to say, I can't do everything, and it's okay to ask for help. I think it's important to normalize that.
I do want to mention that there's a lot of evidence-based caregiver programs that have been shown to be extremely helpful and to reduce stress and fatigue. I know for a fact that Powerful Tools for Caregivers and the Savvy Caregiver, as well as Reach, are all offered in this area. And then there are some other really good ones as well that, you know, may pop up on occasion, but I just want to point it out that there are a lot of caregiver-based programs. So if you're new to this or thinking this is on the horizon for you, look for these programs, enroll in these programs, and get the knowledge and skills that you need to be the best caregiver that you can be.
That's how you prevent, is by being understanding and doing the work. There's a lot of resources out there. There's local, there's national, there's a lot of resources available. But some places to start locally are things like your area agency on aging. Sometimes they have support. Sometimes they have ways to get respite. They're familiarized with local support services. Never a bad thing to look at the pamphlets in medical offices and doctors' offices. Oftentimes these days, medical offices are employing social workers, and oftentimes you can ask, you know, is there someone available that I could talk to about services? And that could very well be available. Your local hospital, oftentimes they have support groups. We don't think about that, but they often do, and they're run again by most of the time by social workers, sometimes by nurse practitioners, stuff like that. And again, don't ever be afraid to say, hey, you know, do you know something? Do you know someone who knows something? Because that's how we find, right? That's how we find out what's available to us. Things like hospice, you know, hospice is not just about the care. It's also about the services that they have available for their caregivers. And they have an abundance of services. United Way is always one that I will say, check United Way. They'll usually have their information and referral lines. You can usually call and talk to someone, or their website in the community will identify, I mean, an A through Z list. And you can be like, okay, I'm going to click on D for dementia, right? And it might indicate, okay, so these are the services, these are your local supports, and you can reach out. Faith-based organizations. I can't speak enough about the amount of services that are available through your faith-based organizations. And sometimes it's not widely discussed, and you just have to ask. You know, I'm going to reiterate the importance of saying, okay, so I'm not sure I need help, and to recognize that. And look local. I think that's important to identify local. You know, there's a lot of large organizations out there, like the Alzheimer's Association, you know, your large cancer associations, dependent on the type of cancer. But oftentimes your local agencies, your local organizations will have local services. They'll have local funding. So you want to think about that.
And speaking of local, I don't know where everybody is located, but I did want to just highlight some of the places that are in Forsyth and Guilford County, because there are a lot of really great general aging resources. Some of them have specifically caregiver services, but Remember that thing about asking for help and delegating tasks. So if you don't want to cook, one time a week, or you want to make sure you have food, some of these services may provide Meals on Wheels, where they have volunteers that will do grocery shopping for you and things like that. So, sharing the care, a lot of these aging resources can really help out. So Senior Resources of Guilford County serves the Guilford County area. Senior Services in Winston serves the Forsyth area. Jewish Family Services here in Greensboro also services the Guilford community. The Shepherd Center is here in Greensboro as well. The Department of Social Services, that should be in every single county, and they often have an aging branch. Now, a lot of people think of elder abuse when they think of social services, but they actually provide quite a bit of other support for aging and older adults. Wellspring Solutions has a caregiver navigator service that is extremely helpful and free. The Stick Center in Winston-Salem is part of Wake Forest Baptist, the hospital. They offer a lot of services as well. And then there are numerous, and I mean numerous, senior and recreation centers that also offer a lot of social engagement and activities for older adults. So I named a few there.
So some large organizations, the National Alliance for Caregiving, this actually is a really, I think, good resource, obviously, because it talks specifically about caregiving, not the diagnosis. And what it does is, I mean, they're an advocacy type alliance, but they also have a ginormous list of services based on diagnosis, based on needs. Again, you can get general help and then more specific resources. AARP, I think if you haven't visited the AARP website, it's a good idea to do so. We often don't think about the extension that AARP provides, and they do have the family caregiving side of it. The Caregiver Action Network. Then we have an elder care locator, which I think is, if you're looking for things in the elder care environment, I think it's important to have services and have locators available in order to do that, because elder care, it spans a lot of different avenues. The Family Caregiving Alliance, there's a financial steps for caregivers. The National Institute on Aging, a lot of research, but also resources, pamphlets, educational opportunities, in abundance. And then the National Family Caregiver Support Program, which is a great place to identify support options.
So we know this can be really overwhelming. I mean, this is definitely part, because most of us don't know anything about caregiving when we step into the role. It's like part of the challenge is navigating all of this and identifying what's going to help me and establishing kind of a new normal. So, I'll share this PowerPoint with Kristin and Stephanie, and you can share the actual PowerPoint rather than just a recording with anybody. So, if you weren't taking word for word notes, that you have all of these services listed. And then Katie and I both just want to say thank you. I mean, caregiving is literally the backbone of our healthcare system, and our society wouldn't be what it is without family caregivers like you. So you're awesome. Thank you so much for doing what you do and taking care of your loved one. And here's our email addresses, and you are more than welcome to email us anytime, any questions, any concerns that you have. We're happy to connect you and tell you more if we can help.
We could talk probably hours and hours on this.
Thank you guys so much for joining us today and everything, and for this information. It was a big help. There are a lot of positive comments in the chat with everything. And like I said, we will send this out in a recording either later today or tomorrow once we get it edited, and it'll be on our YouTube channel.
Does
So
anyone who is on have any questions that they
Yeah.
want to ask before Elise and Katie have to go?
Feel free to unmute if you don't want to type it in the chat.
We did have several comments just about the, just feelings of overwhelm, of guilt that comes with it, of having a little bit of lost identity. Sometimes, like with yourself, when you are caregiving or you're in multiple caregiving roles, like maybe with children or people still in the home, and then additionally parents, loved ones, family members that you're caring for as well. So I think some of us have kind of been chatting about we need like a part two, or let's get into specific topics. And then I had kind of put in the chat too, just talking with you all more. And I don't know if you have any little tidbit about it, but this also might need to be another session or presentation later, but about, talking with employers or your supervisor. What is family leave like for caregivers? I mean, I know that's probably an issue nationwide right now, but and has been for many years. But again, that might not be anything that y'all can answer quickly, but it might need to be a part two to this at some point. But I think that's something that I hear just from the Healthy UNCG side a lot, is people come to us and just not know, what our policy means, or how does it read, or how do you talk, even if there is a policy on it, how to have that conversation and it be understood from a supervisor.
Well, I mean, family leave is supposed to cover it. Now, having said that, it doesn't always. Sometimes you need a professional in your background to help advocate with you for it. It's not uncommon for me to get on or fill out documentation for some of my caregivers to help employers see the necessity of that family leave. Because it is, if you haven't experienced caregiving, if you don't know what it looks like as an employer, you're not going to necessarily understand the need for your employee. So sometimes, again, having that support, having that advocacy in the background is most necessary, but we're not there yet where people fully understand what caregiving truly looks like.
And UNCG is not there yet either. A lot more colleges are starting, and universities are starting to address family caregiving, and not just among their faculty and staff, but among their students as well. But I think UNCG, hasn't really established a policy, an extensive policy anyways. I know they mention it a little bit in some documents, but our country has a long way to go about recognizing family caregiving. And if you guys are big into advocacy, it's currently part of President Biden's structure. It's something structure.
Yeah.
I can't remember. Structure program. He's recommending a lot of things for aging services, and it's in the Senate being debated, and money is being knocked down and taken away from aging services, including family caregivers. And it's an ongoing debate, and it has been for many, many years. And maybe one day, people will really recognize.
Well, and it's about, we're getting slammed in the face, and we will continue to get slammed with this ever aging population.
Things aren't getting better.
Yeah, it's not gonna, it's, if we don't do something, it's just gonna continue to decline. So advocacy is necessary, and, speaking the truth about caregiving and what it looks like is necessary.
Oh, there you go. Thank you. Somebody's been monitoring that. Thank you, Shelley.
Oh.
Yep. I'm not surprised.
That's unfortunate.
And that's where we're seeing, I think, the need in what we offer in Healthy UNCG. We're a small kind of facet of the university, but we have some really great experts like you all, and we have great partners on campus with HR and with some of our academic departments. And so looking at, our role and how we can help with doing some of that advocacy, that training on the supervisor and leadership end, because we do a lot of programs like this where we try to empower and support the person in the role of maybe having that conversation, but also looking at what we can do in our positions at UNCG to help those in those leadership positions be able to receive that and understand how to communicate better with whether it be caregivers or communicating boundaries in the workplace, whatever it might be. I think those are sensitive topics that take a little bit of training on the other side of it too.
Yep. Yeah, absolutely.
Well, this was so awesome. I'm sorry that we were just keeping y'all hanging. I know you all are busy too, and everybody on here. If there are other questions, feel free to send them via us or contact Katie or Elise directly. We will be sending out, like Kristin said, the recording, their contact information. And again, like Kristin mentioned, Katie and Elise, if there's anything you would like us to link or add in additionally, we'll send that out too. And we usually do that over the next day or two, so you have some time to get that to us. But this was great, and it was one of when we surveyed our employees last spring on what they wanted to see more of from Health the UNCG. This was one of the top 3 topic areas people wanted more education and resources on. And we had several that have signed up and said, I won't be able to be there at 11, but please record, send me the recording. So I know this is something that we'll be putting out again as a link on our website, but hopefully we'll be able to do more and, have you all as a partner and hopefully be able to support our employees and those that are making decisions in our university as we continue
Absolutely.
to navigate this. So I appreciate y'all's time.
Thank you.
Same here. Thank you.
Yeah. All right. Thanks,
Bye,
everybody.
everyone.
Everyone.